These days, the streets of Whistler are quiet.
This whole community exists in relation to those mountains, and so when they close, really most things close in our community. So it's been devastating.
At the end of March, Whistler Mountain was ordered to close. The community had become a hotspot, both for travel and transmission.
Unnecessary travel and social gatherings are fueling the fire for the variants of concern transmission as well.
Yesterday, Dr. Bonnie Henry said the P1 variant from Brazil was introduced in BC both in Vancouver and Whistler. It then spread as people traveled. Today, there are 878 cases of the variant in BC, and some experts say that could have been avoided.
It's likely that restriction of travel will make a difference or would have made a difference. It's made a difference in many other countries around the world. It's made a difference in the Atlantic part of Canada.
BC hasn't banned travel, either regionally or provincially. It's only recommended against. But it's not too late, especially as we continue to learn of new variants around the world.
So we're learning more about the variants all the time. So restrictions going forward could reduce the number of these variants that could come to Canada and particularly to BC.
Over the long weekend, the small tourism town of Tofino saw a boost in tourists, not as busy as a normal Easter weekend, but an increase from the usual. Premier John Horgan, for his part, said it was outrageous people chose to travel to the island, but when it came to action, he threw up his hands.
Do we arrest them? What do? We urge them to go away.
Political opponents say there's plenty that can be done.
We are in a state of emergency. This government can make health orders about anything they want if they want to do that, and they are choosing not to.
If the province wants the public to follow the rules, First to Know says they need to make it a rule and not a recommendation.
Being very clear, this is an order. Do not travel out of your region unless it's for work or necessary, medical appointments. That's clear. But what we've had for a long time has not been clear.
But so far, the government has dug in its heels, instead focusing on vaccination. Joel Ballard, CBC News, Vancouver.